we're here today, and this is my brother John, and he's going to tell us about a bone disease that he has. It's called polystotic fibrous dysplasia. Can you tell us a little bit about what that is?
Sure. Fibrous dysplasia is a congenital bone disease that causes the bones to be brittle, causes them to be deformed along the way. Polystotic just means that it's in more than one bone. For me, it was all in the left leg. It was the femur, the tibia, the fibula, and ended up in the ankle.
Okay. Did you have any symptoms?
Yes, my parents first noticed when I was 4 years old. I started to walk with a severe limp. That was due to the fact that the bone never hardened in my left femur, and as I continued to put more weight on it, it continued to bend, which was called a shepherd's crook, and caused that limp.
Okay. And what treatment was utilized, and was physical therapy involved?
Sure. There were years and years, most of my childhood, multiple major surgeries where they would take bone grafts from other areas, primarily my left side here would be taking healthy bone, grafted into the femur, trying to get that healthy bone to take. Alongside of that, there would be surgeries to add rods and pins and all of those kind of things. Eventually, the discrepancy between the two legs got to be 7 or 8 inches, a difference in the lengths of my legs, so they started cutting growth plates on my good side so that my other side could catch up. After every one of the major surgeries, I would be in a body cast from my chest down to my toes for about 6 months, and the ligaments would draw in and tighten because they didn't have it, the knee didn't have an opportunity to bend, and so I would always have to go back after getting a cast off to physical therapy to stretch those ligaments, which was a very painful process, and then also to learn to walk again. So physical therapy was an ongoing part of my recovery after surgeries. We would make many trips back to Shreveport to go see the physical therapist a couple times a week.
Okay. And are you currently on any medication now?
Yes. I continue to have some struggle with the disease. It still makes my bones brittle. Once late 2011, I broke my hip again, and then early in 2012. And in response to those two breaks being fractures due to the disease, I started with a new doctor specialist out of Dallas, and he has put me on some experimental medicine. It's a medicine that is for osteoporosis. It's not experimental for those who are dealing with osteoporosis, but they're trying to see how well it will work for fibrous dysplasia. So they put me on this medicine, and it seems to be working because I haven't had a break since early this year. So
wonderful. Okay, and does your insurance cover this cost of the medication?
Yes, I don't know exactly what the final cost is without insurance, but I know with my insurance, which is Blue Cross Blue Shield, it's still around $40 a month, my part of it.
It's still pretty expensive.
Mm-hmm.
Okay, and lastly, is there anything that you would want to tell a room full of PTA students in regard to providing better patient care?
Sure. Just my part of the story is, of course, I would dread going to see the physical therapy room because it meant, for me, most of the time, that very painful process of stretching ligaments so I could bend my knee again. So it meant pain, lots of pain. And at the time, I'm sure I wasn't very grateful, and I'm sure I didn't look forward to going. But I can tell you, since I've grown and left, every time I go back to that hospital, the Shriners Hospital for Children in Shreveport, I go to the physical therapy room, And for years and years and years, it was some of the same people that treated me. But even if it isn't, I go in to thank them for what they do, because they would help me to walk again. They would help me get back where I could move. And I just so appreciated what they did. I hope that each of your classmates would be doing this, be learning about how to become a physical therapist so they can help people to get back on their feet. And what a rewarding thing that is.
Well, thank you. Thank you so much for your time.
You're welcome.